Welcome back to PACU Nursing Minutes. My name is Nurse Kathy, and this is the beginning of a new series called Pain Management. And before I jump into the pathophysiology and all the different modalities and ways in which we can manage pain, I just want to open up with a story, because this story was a huge life change for me. And it grew me as a nurse, it grew me as a person. And through going through this experience, I learned so much about ortho pain and the patient's experience. So let me share with you my story. So we're going to reverse 9 years ago, Groundhog's Day. It's a bluebird day in the Pacific Northwest, and we just had fresh snowfall over a foot. And the setting is on Crystal Mountain. And my husband and I, we both had off from work that day. So we scooted on up to Crystal. And because the snow was so great, we decided that we were going to go up to the top of the King and then hike back into Silver Basin, and then come down Silver Basin and then reconnect at the resort at the top of Chair 4. And we had our brand new puppy dog in tow. Our friends were working on the mountain in the aid room, and it was a beautiful bluebird day. So excitement was in the air, and just really excited to skin up and ski down and get some fresh powder in the Pacific Northwest instead of chowder. So we did exactly that. We went up to the top of the King and hiked over to the top of the Silver Basin Bowl. And then we came down it, and the powder was really nice and light and fluffy for Pacific Northwest conditions. And my husband, he told me as we got lower on the mountain, as we were dropping elevation and coming into inbounds, he said to pay attention because the snow is getting grabbier. And I had headphones on, so I didn't hear his words of advice. And we had just gotten inbounds, and we were at the beginning of a cat track at the top of Chair 4. And I thought, wow, I really want to, have some more fresh powder. So after we had our little break at coming to inbounds, he dropped in ahead of me, and I decided that I was going to transition off the cat track and over to the fresh powder to my right. And as I did that, my right ski transitioned just fine, but the tip of my left ski got stuck in an ice chowder layer, and I immediately had an above boot fracture because it was an immediate stop, and I fell forward and experienced the most significant amount of pain I've ever experienced in my entire life. I screamed, my husband heard me, and he had to hike back up to me. There was nobody around us because Chair 4 was closed because it was midweek. So once he got up and he saw my condition, he immediately knew that I had broken my leg. So he had his cell phone. He called down to the aid room, and the patrollers were dispatched to come get me. In the meantime, he got me my leg buried in snow to help minimize the swelling. And he just was with me, comforting me, reassuring me that everything is going to be okay. And it took a while for the patrollers to get to us. Once they got to us, they had a toboggan. And so they loaded me up in the toboggan, and I got sled down the mountain to the aid room. And that was some significant amount of pain, being tobogganed without any pain medication on board with a fresh fracture. So that took my breath away. Once I got to the aid room, a good friend of ours, Matt, he was the paramedic working volunteering that day. Unfortunately, we met under these circumstances. And he was fantastic. He gave me intranasal fentanyl so that they could take my boot off and realign my leg as best as possible. And I pretty much kind of, after the intranasal fentanyl, everything kind of just blanks out. But I finally had relief of the pain, and I think I just kind of, I didn't pass out, but I definitely was able to finally relax and just you know, go through the motions of this injury. So an ambulance came up to Crystal, and they mediced me down to Tacoma, and then there I went to the ER, and then from the ER I was admitted, and then the next morning I had a rod placed in my tibia to stabilize the tib fib fracture that I had. So I was working in the neuro ICU at this time, full time. And unfortunately, if you can't walk, you can't work. So I was immediately out of my full-time job, and I had to take the short-term disability and then long-term disability. So I had a whole new experience of going through that process. And it really was a pivotal point in my life, just reevaluating where I was going, what I was doing, and also learning about ortho pain and rehabilitation. It was a bad fracture. I was in the hospital for 5 days. My pain management was horrible. I was either writhing or nearly unconscious, because my husband, he said that I had a fentanyl PCA, and he was joking. He said it was like as if you were in Las Vegas or something, and I'm not a gambling person, but he said my little PCA button, he was like, I kept hitting it saying, hit me, hit me, hit me, hit me. Because the pain was really through the roof. And I tell you, the most profound benefit that I found with pain management with ortho was with ice. So once I was out of the hospital and home, I found out that actually I was pregnant. And so I stopped all pain medication. And the main way that I managed my pain was through icing my leg. With cold therapy. I had a cryo cuff, and I would elevate and ice it, and I would ice it until my leg was like numb, and that finally took the pain away. And I'd wrap myself up in an alpaca blanket, and that's how I managed. That's how I would go to sleep at night. That's how I got through the day. And pretty much when you have a traumatic fracture like that, the first 3 weeks, you are just resting, icing, compressing, and elevating. There's no rehab to do. Your bone just the swelling needs to go down, and you just need time for recovery. I had a lot of vascular damage. My leg was purple, and I'll share with you some pictures. Yeah, I mean, if I made my leg dependent and tried to get up and walk around, the throbbing would return really fast. So I wasn't able to do that for very long. I pretty much spent a lot of time with my leg up, elevated above my heart, compressed with my ACE wrap, and then my walking boot on. And then once I was cleared after 3 weeks to move forward with therapy, I found the best benefit was to get into the pool and do hydrotherapy. So we were a member of the local Y, and I joined the stroke water group and the water aerobics group, because the stroke patients, they were learning how to do range of motion and water walking. And there was also a rehab group for new hips and new knee patients. And it was really humbling, because I was 34 when I broke my leg skiing, and I was in the pool with patients 40 years my senior, and they were rocking it. They were just doing so great with their new knees and their new hips. And I was really managing with my pain and trying to get the range of motion and working through the nerve damage. You know, I had to be lowered into the pool by a chair and gotten out of the pool by the chair. And once I was out of the water, my leg would turn like purple because the vasculature was still healing and my venous return was poor. So it was a huge experience, and it took me a full year. Plus I ended up getting pregnant with our first son. So that set me back a little bit, because once I was really ready to move forward with my therapy, I was like in my third trimester of the pregnancy and I had to stop. So I just kind of rested and let my body have the rest that it needed so that I could do the best with preparing for motherhood and for a healthy delivery, which I did have a wonderful, beautiful delivery of my first son. And it was a huge blessing. I didn't have any pain medications, because the pain medications, they only made me constipated and really, really loopy. And I didn't want to be loopy when I welcomed new life into this world. So I wanted to be totally alert and coherent. And I have a saying that I will have 10 natural births before I break my leg again. And I've had 2 natural births now, thank the Lord, and I will keep my rod in my tibia for life, because it gives me a little insurance on that bone from ever refracturing it again. And for any of you who are wondering, yes, I am skiing again. I taught my 2 sons how to ski, and I actually ski better now than I ever have before. It's been a long road. I did have significant nerve damage and foot drop from the ski accident, but I've gained about 70% of that nerve function back. And even 9 years later, I'm still gaining nerve function. So I haven't given up on those nerves and gaining that last 30% back. So that's just a little insight about me and my personal experience from going from the nurse